Eagle Radio welcomes you to Health Information Please, a program of wellness news and your chance to ask questions. Here's your host, Mike Cooper.
And welcome again to Health Information Please and our Saturday morning hour of wellness information. Glad you could join us and hope you'll make it a regular habit with us on Health Information Please, the program that's made possible with the support of HaysMed, and available for you to listen to on KAYS, our originating station in Hays, at 14 a.m. and 94.3 FM. You can also listen to the program on KVGB, 1590 AM and 97.7 FM in the Great Bend and southwest Kansas area. The program's also available on HaysPost.com for your tablet or computer, and available for your phone or tablet on the iTunes or Google Play App Store at 94.3 KAYS. And you can also listen and watch the program if you're an Eagle Cable TV subscriber on Channel 14 in the communities of Hays, Ellis, Russell, Waukene, Munger, and Victoria. Our program welcomes phone calls, too. If you have questions about our topic today, we'll be talking about several different areas of interest. Particularly, we're going to focus today with our guests on Medicare Part D. The open enrollment is underway now and will continue until the 7th of December next month for open enrollment for Medicare Part D. And we'll have some information on that with our guests, plus catch up with medical specialists at HaysMed with our guest. All on Health Information Please. Well, the weekend certainly turned cold on us, didn't it? Looks like winter is actually going to come. Joining us from medical specialists, back with us again on Health Information Please, Dr. Elizabeth Snyder. Welcome, Dr. Snyder.
Thank you.
Nice to have you back again. Brought a guest this time, too, huh?
I did.
Tough to talk her into it, too, wasn't it?
A little bit.
That's
I'm sure
fine.
If she gets a lot of good questions on the telephone, she'll warm up.
No doubt about that. Well, we're not going to pick on her too much since she's brand new and a first-time visitor here. No stranger to HaysMed, though, for sure. From the pharmacy department, the retail side of the pharmacy department at HaysMed, Kim Meier. Welcome, Kim.
Good morning.
Nice to have you with us today. Okay, Dr. Snyder, we need to find out about medical specialists. Where is it and what do you do?
All right. So medical specialist is still in the hospital on the second floor. Go in through the Miller Pavilion. There's a lovely renovation there. You can talk to the volunteers as you walk in the rotating door. I believe that the hospital is asking people to use the revolving door rather than the side doors to help with control of temperature.
Yes, that's one of the reasons for that revolving door is that it's so much better in managing these cold temperatures coming in.
It also provides some entertainment for the volunteers as they watch people walk through the door.
No doubt about that. Okay, medical specialists on the second floor then. And so who do you treat and what do you treat?
Okay, as Dr. Curtis, our cardiologist and primary care doctor and medical specialist, likes to say, it's the doctors for adults. Internal medicine. The difference between family practice and internal medicine is family practice takes care of the spectrum. So babies, pediatrics, to adults, we just take care of usually 18 and up.
18 and up then.
So usually we specialize in diseases including COPD, diabetes, that sort of thing.
Okay. Colds and flu treatment too.
Family practice and internal medicine specialize in that for sure.
Indeed, that time of the year once again. On the second floor, and you haven't moved, it's 202, something like that.
Something like 202.
Yeah. Okay. And the Miller Medical Pavilion. By the way, when you go in the Miller Medical Pavilion now, an addition at HaysMed that has been really helpful to a lot of folks is the parking assist. So there will be those who can assist you with parking there, in addition to the information desk, which is there as well, to get you turned in the right direction at HaysMed.
Yes, and so they actually I've had problems with patients coming to the valet parking and not having anyone there to assist them.
Mm-hmm.
And I talked with the people in charge of valet parking, and it's available, I think, early in the morning until about 4:30, and I think they only have one employee there, so if they're helping someone else inside, they just want you to wait and keep your car in that little area.
Kind of a drive-through area then,
Keep
right?
your car in the drive-through area, and someone will come out to assist you. It's just if you're using that service, maybe you should make sure to arrive a little early for your appointment.
Okay, good. Kim Meier is as a part of the retail pharmacy area at HaysMed. Kim, how long have you been at HaysMed?
About 20 years.
Okay, a veteran then, for
Yes.
sure. Always in pharmacy?
Always in, well, I started when I was in high school in dietary. And then I went to pharmacy school and came back shortly after I graduated and have been in pharmacy since.
So if somebody has a dietary question, you're the person?
No.
No. Okay. But pharmacy indeed. Tell us about the retail pharmacy part of HaysMed. This is open to the public, right?
Yes, we can fill prescriptions for anyone, and we accept most insurance plans, so that is not an issue usually. We're trying to do a program called Meds to Beds, or discharge prescription service, where if you're being discharged from the hospital, you can have we'll come up and get your prescription and your insurance information and all of that, and then bring it back down to the pharmacy, fill the prescription, and then deliver the medication to your bedside, so you'll have it before you leave the hospital.
So you can take it with you, basically,
Yes.
then, as you are dismissed from the hospital.
Yes.
Okay. What got you involved in pharmacy? Switch from dietary to pharmacy?
Well, I did dietary when I was in high school.
Oh, okay.
So that was just a beginning job.
Uh-huh.
But it got my foot in the door in healthcare, and I don't really care for blood and needles and that sort of thing. So pharmacy seemed like a good option.
Well, we already have a kindred spirit in that particular area for sure, since we don't talk about that on this program. Those are two things that are forbidden to talk about, for sure. But in the pharmacy area, there's a lot of training pre-pharmacy that goes into this, isn't there, Kim?
Yes. I had, there's 2 years of pre-pharmacy before you get into pharmacy school, and then now it's 4 years of pharmacy school, and after that you can do residencies to specialize in different areas to go on.
And you might have noticed that Kim's last name is Meier. There is another association in the hospital area of the pharmacy, right, Kim?
There are actually 2 others.
Uh-huh.
My husband, Todd, is also a pharmacist at the hospital, but then there's James Meier at the pharmacy.
Not to be confused with Todd.
Right.
Okay. All right. But so Todd works in the retail area as well?
He works in the inpatient pharmacy.
Inpatient with James then?
Yes.
Okay. Are you solo then in the retail area?
Yes.
Okay. And what about hours? Do you keep pharmacy hours like
The retail pharmacy is open Monday through Friday from 9 to 5. We're closed from 1 to 1:30 for lunch.
Okay. So if Elizabeth writes a prescription then, they can take it right to the pharmacy there at HaysMed?
Yes.
Yeah, and they actually accept electronic prescriptions too, so most of the time we don't write prescriptions anymore. We just send it through the electronic program.
Aha. So no more physician's handwriting to deal with then, as the old saw goes, huh?
Right.
Just technology problem.
Kim is smiling now. She's been through that before a couple of times.
We traded handwriting problems for other computer problems.
From computer problems, yes. Probably about the same, probably, in some instances of frustration, I would suppose. Dr. Elizabeth Snyder from Medical Specialist, second floor at HaysMed in the Miller Medical Pavilion, and the pharmacy with Kim Meier. Located where, Kim?
We are in the basement of the DeBakey Heart Center, so entrance A.
All right, entrance A, parking lot A.
Yes.
Take the elevator down, and you can get to the pharmacy that way.
Correct.
Okay. So we talk about Medicare Part D expansion, or open enrollment, I should say. And first of all, though, Dr. Snyder, what are you dealing with in medical specialists? Flu, cold situation now coming in?
We are starting to get a little bit of colds. I haven't heard of any confirmed flu cases yet. I did look, and there have been 3 deaths from the flu this year so far in Kansas. So, I mean, the flu season is certainly starting, but I think it's certainly in its early stages here right now.
As we have talked about on this program before, when it concerns flu, Dr. Snyder, those who are dealing with other medical issues are somewhat more prone to problems with the flu developing into other areas like pneumonia and such, right?
Yes, correct. So people who are at higher risk for more severe disease from the flu are children, babies and children, and also older adults, and additionally people who are sicker in general with diabetes or heart disease certainly have more at risk for severe disease.
So is it too late to get a flu vaccine?
It is not. And so what I commonly hear in the clinic is that people say, oh, I don't get sick. I don't need the flu vaccine. And my response to that is, but you are around other people who can get sick. So even if you're just barely sick or not at all sick, you're going to be at the grocery store, you're going to be visiting your parents or your grandchildren, and the less likelihood that you have the flu to transfer to them, the safer that they're going to be.
You're actually getting protection for yourself from other people, not necessarily something that you might encounter on your own, huh?
Right. And then other people, the flu vaccine is not perfect. It's not going to prevent the flu all of the time. Really, it's just showing your body the flu virus, and thus your body makes a little bit of an immune response so that when you actually are exposed to the flu, your body can fight it better. So it's not going to prevent the flu, and certainly a lot of people say they have a little reaction to the vaccine. Of course, anytime you put something in your body, your body's acting like it's an actual infection. So your body might feel sick, like there's an actual infection there. But
mild cases in most instances, maybe a little bit of soreness around the injection
definitely
point.
I was sore for a few days. Were you sore for a few days?
Yeah.
A couple of days.
Yeah, same thing.
Yeah.
But knowing that you've got that immunity is something that's pretty valuable, especially with the potential for flu developing into so much more serious situations for people, Dr. Snyder.
Right. And if you get sick after you get the flu vaccine, certainly some vaccines that we have actually can give you a little bit of the infection, but the flu vaccine that we have out right now doesn't actually give you the flu. So if you get sick, it's one of those other tens of hundreds of viruses out there that are making you sick.
What's the preventative measure here in addition to the flu vaccine? Anything changed as far as our preventative to be able to ward off colds and flu?
Hand washing is certainly up there.
Still number one, I would
imagine. I try to wash my hands before every patient anyway, but I'm being extra cautious now in washing my hands before every patient and also after every patient. Hand washing is up there. And then also just your general health of getting a good night's sleep, being well rested, making your body as healthy as possible so it is strong and can fight an infection if you get it. I think sometimes, we live very busy lives, but when you're starting to feel sick, you can take the time and rest and get a good night's sleep. I think that's one of the best things you can do to prevent that developing into a severe infection.
Yeah, Brian Noon, director of the Sleep Institute, would certainly echo that sentiment. A good night's sleep to help ward that off and maybe try to reduce that stress level. It seems like times of high stress automatically seem to translate into lower immune system for the body and maybe more prone to getting a cold or the flu at that point.
Unfortunately.
Yeah. Kim, tell me about hand washing. The hand sanitizers, the alcohol-based spritz things, are they effective?
They are effective to kill germs. They're not effective to actually clean hands that are soiled. But they do a pretty good job of killing the germs that would be on the hand.
So if I've handled things at the door to the studio or on the control system or something, probably a good idea to use that hand wash or wash the hands.
Right.
Okay, because of the main way that's translated as far as transmitting cold and flu viruses?
If you have access to wash your hands with soap and water, that's better than the hand sanitizer. But if there's not an option for that, the hand sanitizer certainly would be better than nothing.
Okay. Dr. Snyder, back to you for just a moment. Again, you're seeing some cold symptoms, but not necessarily much flu yet?
Correct.
Okay.
And the allergies are still in season also.
Allergies. Oh, yes, indeed. Seems like they're 24 hours, 365 days a year at the time. So what allergies are we contending with now?
I'm actually not sure. I think it's harvest. Is it Milo harvest?
Right, yeah.
A lot of people are reacting to that right now.
Ah, yes. How about maybe the cold temperatures and such? Any kind of reaction that the body has to these frigid temperatures?
I mean, sometimes the cold temperature can make people's asthma kick up or something. It's certainly making people's arthritis kick up.
Ah, okay. All right. Yeah, 18 degrees here at our studio this morning. Health information, please. Brought to you by HaysMed, available on KAYS, KVGB, Eagle Community Television, HaysPost.com, and the iTunes and Google Play apps at 94.3 KAYS. By the way, for area events for Veterans Day, be sure and check out GreatBendPost.com and HaysPost.com. Kim Meier came to talk about Medicaid Part D or Medicare Part D expansion and open enrollment. Talk about open enrollment. Who can enroll? And we said December 7th is the cutoff day, right?
Correct.
Who should enroll? What's the procedure? Take us through that, Kim.
If you're over 65 years old, you are eligible for Medicare. Anybody who does not have coverage from another insurance, an employer or anything, should enroll, especially in the Medicare, the prescription drug. Even if you don't have prescription medications currently, there's a penalty that is instilled if you are eligible and you're not enrolled, and they add that to your premium when you finally do enroll. Then you're paying a higher premium or more monthly cost than what somebody who enrolled right away would be paying.
Now this is an interesting piece of information. Take us through that again to try to clarify as much as possible here. The Medicare enrollment for those who are retired, who are no longer working, who do not have a health insurance policy with their employer, right?
Right.
Okay. Now, what about the prescription part? Because some have enrolled in other prescription plans.
If you're enrolled in an equivalent prescription plan to Medicare, you won't be penalized for not enrolling in Medicare Part D.
Aha.
But if you don't have an equivalent prescription plan and you don't enroll in Medicare Part D when you are eligible, that's when the penalties will start. And
if you've been on Medicare for a while, you do not enroll in the prescription plan now because supposedly you have a current applicable prescription plan?
If you are employed, your most employee prescription or most employee insurances are equivalent to Medicare, but that's something that you would want to check with the Human Resources Department to know whether you have equivalent coverage. Even if you're insured through your employer, if it's not equivalent coverage or if Medicare doesn't see it as equivalent coverage, you would be subject to penalties for not enrolling in Medicare.
Okay. And if you're retired and you have a current prescription plan through an outside source, are you okay then?
Yeah, as long as it's an equivalent
plan. Okay. Which many of the high-profile plans, I would assume, are. Yes. Or should you check with Medicare to be sure?
Or you should check with your employer or Medicare or whoever you have your insurance through. If it's a spouse's insurance, but whoever you're insured through should have, whether it's equivalent or not.
Mm-hmm. Okay.
And you will need proof when you're enrolling in Medicare that you had equivalent coverage.
All right, which would be?
Like a letter from the insurance that you had.
Okay. Now, would that be talking about Medicare supplemental insurance? Through, like, Blue Cross Blue Shield, for example.
Right. But if it's a Medicare supplement, I guess if it has the prescription coverage on it, it would be equivalent.
Mm-hmm.
But if it's a standalone, you're not going through Medicare, you would have to prove that it was equivalent to what Medicare offers you.
Okay, so even though you have a supplemental insurance plan, if you don't have the prescription writer on that plan, then you need
the
prescription coverage plan of some type.
Right.
Okay, gotcha. All right. It's a complicated situation, to be sure, and each individual situation is going to vary. But if you'd like to ask questions about your specific area, we'll see if we can walk you through it, and there'll be some areas where Kim may not have the answer for you, but she'll do her best to try anyway. 625-1114, or if you're outside the area, 785-625-1114. Open enrollment now, and this would be, Kim, again, for those who are 65, they turn 65, or
anybody who is eligible for Medicare. This is the open enrollment for the prescription drug plan, whether you have one already or whether you're just needing one.
Okay.
If you have a plan already, it's a good idea to still look to see if the plan that you're currently on is still right for you.
Okay. And by being right for you, explain that a little bit more, if you would, Kim, as far as what's a standard that maybe those of us can look to as far as being something that's appropriate for us?
I like to use Medicare.gov. On their website, you can tailor looking at the different plans that are available. And you can put in what medications you're taking, what pharmacy you go to, what you want to use. And once you have all of your medications in that you're taking, you can compare the plans that are available. For 2019, there's 26 potential medication plans available.
And there are certain agencies can help you walk through that process as well. Northwest Kansas Area Agency on Aging, for example, is one of the best I've found.
They do a great job with it.
Yeah, they do a great job. But Medicare.gov, that's a great website, too, by the way. That's really well done, whoever set that up.
And if it's too confusing or if you don't understand how to do it, your pharmacist can help, or the area on aging.
So you can walk some folks through it, too?
Yes.
Good deal. That's good to know. Because as a pharmacist, you're going to be aware of current medications as well as being able to identify those medications on the website and put in the appropriate names, right?
Right. And there's different of those plans will cover different medications, depending on what is on their formulary, meaning that they have a list of medications that they may cover. They're not going to cover every medication in a class of medications. So maybe you're on metoprolol, but this plan only covers atenolol. So they're similar medications, but one's covered under one plan and one's covered under a different plan.
Yeah.
Dr. Snyder?
And so I was looking at this website, we trying to prep for this. I personally have not gone through this Medicare.gov yet with my parents. However, I was looking and I was thinking, a lot of these medicines that you can put in, sometimes there's alternatives. Like if you have a patient on a blood pressure medication and you're only on one or two, often there's options where they could switch a medicine and it would be better covered by their insurance. But then there's other medicines that are more specific for a patient's disease, like maybe your cardiologist really wants you to be on carvedilol and not metoprolol, or maybe your cardiologist wants you to be on atorvastatin and not one of the other cholesterol medicines. Sometimes it matters which one in the class you're in, and sometimes it doesn't matter.
So that's the reason you need connectivity between your physician, Dr. Snyder, and your pharmacist, Kim Meier.
Right. And if there is a specific medication that you need to be on, you want to make sure that you're looking for a plan that's going to cover that specific one, rather than asking your doctor, hey, my plan is saying that I need to try this one. During this open enrollment time, you can actually switch plans for the medications that you need to be on. But after December 7th, then you're stuck with that plan for 2019.
So it would benefit somebody who is taking prescription medications for whatever reason, blood pressure, heart condition, diabetes, anything like that, to ask you about appropriate medications, and Dr. Snyder as well about alternatives. Am I on the right track here?
Yes.
Okay, got it.
Within whatever plan that the patient chooses, there's different levels of the plan. You have a deductible phase, the initial coverage phase, but then after you have so much in drug costs, you hit the donut hole.
Yeah.
I think everybody's heard of the donut hole, and it's the coverage gap, where you're essentially paying a lot more for your medications. If it's a brand name medication, it's, I think, 25% of the cost of the medication, which can sometimes be hundreds of dollars for one medication.
Yeah, depending on the medication itself and its expense.
Yep. So that's where it becomes important to work with the doctor and pharmacist to find alternatives that would be appropriate, but maybe less expensive.
Is the donut hole the same for each individual who's under the Medicare coverage?
It is the same, but some people hit it faster just depending on the price of the medication.
Because of the medications they're taking. Okay. And in that situation then, there is that, where does that start? Do you have a dollar figure on that? Do you remember what that is?
I have it somewhere.
Somewhere. All right. You look for it, because I'm going to ask Dr. Snyder to weigh in on the number of medications that have become generic and how this fits into the overall picture. What's the situation here on generic medications as opposed to brand name, Dr. Snyder?
I find that most often generic medicines work just as well as brand name medications for patients. So patients are generally safe taking the generic. Unfortunately, there's a lot of new medicines that are actually quite good, especially in diabetes, and also some heart medicines that there just aren't generics available yet. So particularly for diabetes, if you want to be on one of the new insulins like Tresiba, or if you want to be on one of the new GLP-1 medications like Bydureon, there just aren't generics of those yet, and so that you're going to have to pay for
They're too new, basically, and the patent is still in force, and I'll bet they're pretty pricey, too.
They sure are.
Because of the way they're advertised, I would suspect that's probably the case. So, Kim, would you kind of echo what Dr. Snyder is saying about generics?
Yes. The FDA approves generic medications, and they have to be within a 5% of the original brand name medication. And even within a brand name medication from lot to lot, there's variance in...
So the 5% could be in a brand name, even a variation.
Yes.
Okay, all right. But generally, a generic obviously is going to be much cheaper.
It is much less expensive.
But as far as your experience goes in the pharmacy area at HaysMed, that the generics do the job, work as well, and have the same efficiency.
Yes.
Okay. Dr. Elizabeth Snyder from HaysMed, a medical specialist, second floor at the Miller Medical Pavilion. That's parking lot B at HaysMed. And 625-1114 is the number to call. Kim Meier is in the retail area of the pharmacy at HaysMed, downstairs going through the DeBakey Heart Institute entrance. That's entrance A, and downstairs through the elevator in the basement, you'll find the pharmacy at HaysMed, the retail side with Kim Meier. And your phone calls are welcome at 625-1114. If you're outside the area, joining us on KVGB, Eagle Community Television, HaysPost.com, or the 94.3 KAYS iTunes app or Google Play app, call 785-625-1114. Same phone number, just the 785 area code ahead of that. Find out more about medications as far as prescriptions with our guest, Kim Meier, from the retail side of the pharmacy at HaysMed, and medical specialist Dr. Elizabeth Snyder. I told Kim ahead of time, Dr. Snyder, that I wanted to ask about numerous prescriptions that patients may be taking. I've heard and read of people that may be taking 4, 5, 6 prescription medications, and what do we need to know about those, and what should patients who are taking this number of prescription medications, what do they need to do and know about? Give us some education here, would you?
Well, I think anytime you get more than a few medications on board, the likelihood that you're going to have interactions between the medications is high. Mm-hmm. There are some medications that have more interactions than others. For example, warfarin, which is a common blood thinning medicine, has a lot of interactions. Mm-hmm. But also there's interactions just between the cholesterol medicines, and they also interact with a lot of medicines. I don't know how much it's really important for patients to know the details about the interactions, but it is good to recognize some of the main side effects. For example, if you're starting a medication and then you start to develop symptoms, it's good to know. People often will just look it up on the internet, is this side effect related to my medication? But if you're starting, say, Wellbutrin and then you develop tremors, that's a relationship to that. It's also good to know, like, some medications will increase risk, like Wellbutrin, just since I mentioned it, increases risk for seizure. So certainly your doctor should know that you have seizures, but if, something happens and you have a complex medical history, maybe you hadn't mentioned that you'd had a seizure in the past, maybe that'd be a medicine you don't want to try. Mm-hmm. It's hard because I find that a lot of patients, if they read the list of side effects or potential side effects, they don't want to take the medicine. Or reading it will sort of plant the idea in your head and you'll feel like you're having those side effects. But in a way that's actually good, because, if there's something, if a lot of medications simply aren't, blood pressure medicines are necessary, diabetes medicines are necessary, but a lot of medications that we have people on, such as like muscle relaxants or pain medicine, some people, you can tolerate your pain or your muscle spasms without the medication, and maybe reading the side effects will make you feel like it's not important. Maybe in the case of a statin, for example, you might get some muscular pain. It's not debilitating, but at the same time, that statin is a benefit to you. Right. And if you are having pain and you are on a cholesterol medicine, it's a good idea to at least tell your doctor so they can do blood work and make sure that there's not changes that are concerning due to the statin. And would you say it's fair enough to say that if a person is starting a new prescription and they are experiencing something, the body is saying, wait a minute, there's something going on here, they ought to investigate? Right. I think it's important for people to know about their health and to know about the medications that they're on. I find that a lot of patients who do the best are the ones who are most informed about their disease, whether they have diabetes or lupus or rheumatoid arthritis or, whatever. The more you know about it, the more you're aware of potential complications and what symptoms might be related. Well, Kim, you're a veteran of about 20 years in the pharmacy area, so weigh in on this particular area about the importance of recognizing the interaction that drugs may take, and talk a little about timing, too.
I would say having a good relationship with your pharmacist is probably really, really important if you're on multiple medications, especially starting anything new. And if you would have, like you were saying, a symptom after starting something new, I would definitely talk to the doctor, talk to the pharmacist, call back and say, could it be from taking this? This is the only thing that I can think of that change. And I do think it is important if you decide that
a lot of patients will feel like, yes, the symptom is strong enough, I want to try stopping the medication. It's important to call and leave a message for your doctor and let your doctor know what the side effect was and that you have decided to try stopping it, because your doctor probably started that medication for a reason, and they can decide whether you need an alternative medicine.
Very good point. Don't just stop it on your own without some input from your primary care physician or physician.
So you brought up a good point, or Kim did, about a relationship with your pharmacist. And one thing I'm seeing a lot of now in clinic is a lot of people's insurance companies are preferring that they use mail-in pharmacy companies. So with these mail-in companies, they do you send the prescription just like any other pharmacy, and they generally require a 3-month supply, and then they just mail the patient the supplies every 3 months. Generally, there's a financial benefit, so they can be a bit cheaper with the mail-in pharmacy. But the concern is, you're not developing, you don't have that extra layer of protection of a pharmacist knowing you and being able to talk to the pharmacist about what to expect when you're starting the medicine, what questions you have when you're reacting to the medicine. It's really disappointing for me that insurance companies are choosing to go this way.
Yeah, that's a good point, I think, because that relationship with a pharmacist, whether it's at HaysMed with Kim or with any of the other fine pharmacists in the area, they know the patient. Whereas, gosh, that's like ordering, well, I can't think of an example right now, but
I don't know, maybe it's like ordering clothes online. That never works for me.
Yeah, it never fits, that's send it back, that kind of thing. But Kim, that personal, first of all, you're going to know if you've got a patient, what that patient is taking, and you can warn them about interactions or potential side effects face-to-face and person-to-person.
Right. And if you get a new medication through mail order and you do have a side effect from it, you don't have anybody to go talk to.
And you have a 3-month supply.
Plus you've spent 3 months' supply. That's usually the minimum order on these things.
Right.
I
was thinking something else.
Bring it back whenever you do. So basically, interaction of medications. Tell us more about that, Kim.
Well, like Dr. Snyder was saying, there's a lot of medications that do have the potential to interact just by the way they're eliminated, where if they go through the same pathway to leave the body, then they compete for that. So you have more of one medication around because the other medication is the one that's leaving the body. So a lot of interactions occur that way.
What about timing? What do you tell patients about timing of medications? Because I hear that some should be taken with food, not on an empty stomach, all of the kind of warning areas. Morning, evening, middle of the day, what kind of tips would you give us?
That depends on the medication and the patient.
Oh, that's the easy way out of that one.
It's very specific, though. If somebody doesn't get up in the morning and have a relaxing morning, where they can remember to take the medication, but they would do better taking a medication in the evening. So something that's once a day, that doesn't matter whether it's taken with food or not with food. They can decide what time of day works best for them. But then there's other medications that need to be taken with food, so then you're looking at trying to find a meal that they're going to best be able to remember to take it.
Another advantage to a face-to-face visit with a pharmacist,
right?
Be able to talk about those particular issues. And I'm not even sure in this mail order thing whether you'd even get that kind of feedback.
I was wondering that also. So, I don't know if there's a phone number that you can use to call and speak with a pharmacist at these mail order pharmacies. I'm not sure. But if there is a phone number and you have to use mail order pharmacies, I would call and touch base.
Yeah.
Yes.
I'm not sure I'd even go there.
The point I was going to make is I get questions from pharmacists here in town where they review my order and they have a question or a clarification or a concern about the medicine, and I have never received anything back from a mail order pharmacy. So I'm really concerned that they're not reviewing it as closely as our pharmacists in town are doing.
It just makes sense. I mean, it's a for-profit situation for these mail order companies, and they're going to cut corners and costs where they can, Kim.
Right. And usually there is a financial benefit for the patient also, but there's also risks involved with it. And then sometimes prescriptions get mailed out late, and then the patient doesn't have any.
Yeah, I've seen that problem of they're not getting their mail in time, or their diabetes supplies in time, and then they're without for a few days. They're either without, or they have to go to somewhere local and pay out of pocket because the insurance has already paid for the supply that's coming from the mail order, so they don't pay again. So the patients. I wonder if in like 5-10 years the insurance companies are going to realize their error and go back to local pharmacies.
Yeah, the insurance companies are looking at the bottom line profit as well, and if they can save a few bucks here on this particular area, but at the same time, as a former employee of mine said at one time, pay me now or pay me later, depending on the situation, a face-to-face with a pharmacy, I think, is a valuable tool that you can't get through a mail order.
I completely agree.
You can also ask questions, too, and like you said, Dr. Snyder, that maybe through this telephone situation that you don't necessarily have an opportunity to get feedback, and certainly that mail order pharmacy may not know about the other 3 prescriptions you're taking.
Yeah, and that is a danger, too, as I see patients use multiple, maybe a mail order pharmacy for some medications and then a local pharmacy for another, or maybe Walmart for some and Dillon's for some. And you're still creating risks by getting medications from multiple providers. I mean, medicine is very complicated, and the more layers of people you have watching over you and looking at your medicines and your reactions, the safer you are, and I think the better outcomes you'll have.
One of the things that I can think of is if you go to the cardiologist and get a medication and have it filled at pharmacy A, and then you go to your primary doctor and get a medication and have it filled at pharmacy B, and the cardiologist doesn't know what the primary doctor filled, and then you've got 2 different pharmacies that don't know that you're on those medications. And if there is a medication interaction, it does put you at risk for having that interaction by using multiple places.
Some good information here today on Health Information Please with Dr. Elizabeth Snyder, and from the pharmacy department, the retail side at HaysMed, Kim Meier. Once again, medical specialist, 2nd floor of the Miller Medical Pavilion. You still open for seeing patients for sign-up?
I am indeed.
You've got 1 slot left open, right?
I think Dr. Albright and I are both accepting patients.
Good. All right, Dr. Albright.
There might be a little bit of a wait time, but we'll try to fit you in.
All right. And the pharmacy, the retail side of the pharmacy at HaysMed. Kim, you're located where again?
In the basement of the DeBakey Pavilion.
All right. You're going to get some people who are going to come down to the basement there in the pharmacy area and face-to-face ask you questions about medications, and maybe sign up as a pharmacy at HaysMed because of the expertise you brought to the program today. We appreciate that very much. And your work as a pharmacist, too, because it's a very important part. I mean, Dr. Snyder's important, but pharmacy's important, too, because of the actions, the reactions we can get from whatever prescription or whatever over-the-counter drugs we're taking. You got to know what you're doing.
Right. It's a good idea to talk to a pharmacist before you start any new medication or any over-the-counter medication to make sure that it's not going to affect your prescription medications.
And you're open once again when?
9 to 5, Monday through Friday.
Okay, with a lunch at?
1 to 1:30.
1 to 1, just a half hour?
Just a half hour.
What is the matter with these people? Goodness gracious, half-hour lunch. Sounds like a teacher, Kim. Congratulations, and thanks very much. You did an extraordinarily good job today. Thanks for coming in. Health Information Please today, brought to you by HaysMed, featuring Dr. Elizabeth Snyder from Medical Specialists on the 2nd floor and in the basement of the DeBakey Heart Institute. the retail side of pharmacy with Kim Meier. Next week, we'll talk with Sue Knoll. Sue is in charge of hospice and palliative care at HaysMed. She'll be happy to answer your questions about this important part of another of the areas of the expert coverage and help that we get from the staff and all of the people at HaysMed. Thanks for joining us today. Thanks to our studio engineer, Dave Cox, as always. Enjoy your weekend, and remember Veterans Day and our salute to those who served. Tomorrow, Veterans Day 2018. Thanks for being with us on Health Information Please on KVGB, Eagle Community Television, and KAYS. Get